on the horizon in the not so distant future. Maybe even in fact, right now, depending on when you're watching this, it will be AEP, and that is the annual election period for Medicare. And Medicare companies, they will be beating down your door, your phone, your internet, your TV, basically everywhere. They will be marketing their new, improved, shiny 2025 editions of Medicare Advantage plans. And that's all good and fine. But remember these 5 things before you change, before you enroll, or before you update your Medicare Advantage plans, and the rest will be all gravy. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them this AEP, or really all year round, give us a call at the information down below, and we can help them to make those tough Medicare choices. Medicare Advantage is quickly becoming one of the go-to plans for Medicare beneficiaries, new and old. And it's because of, 1, the low or no monthly premium, the wide expansion of benefits, including a lot that are not covered under original Medicare or even Medicare supplements, things like, dog walkers, Part B reimbursements, gym memberships, and groceries. But all that is really going to be fluff because the core fundamentals of your coverage, they still don't change. And companies know that. So there's a lot of pyrotechnics and exotic benefits that often try to win somebody over, even if the basics of the plan don't fit. So here are 5 things you should look at first if you're going to look at changing your Medicare Advantage plan. First and foremost, the thing that anyone should check with their Medicare Advantage plan is whether or not it's even available in your area. Now this may seem strange because original Medicare doesn't really have any boundaries on it. So as long as you use it in the United States, you can pretty much go to any doctor that takes Medicare from C to shining C. But Medicare Advantage is more localized. This is because it is based on doctors' networks, IPAs, and negotiated contracts, and because the predominance of Medicare Advantage plans are managed care HMO. That means that even with the same company, there may be completely different plans if it is offered in, let's say, Northern California versus in Southern California. Additionally, some plans may have specific enrollment requirements, like you have to have both Medicaid and Medicare, or specific illnesses to qualify, because even the best plan out there that you see online, you see on TV, you hear on the radio, wherever you hear it, if it's not available in your area or it's not available to you, then it's probably not a good match. Next up, and sort of obvious, but it's not always obvious, is the Medicare Advantage plan a good fit for your budget? This is because there is not typically a monthly premium for most Medicare Advantage plans, except for a few PPO plans and maybe even a smaller number of carriers who are just kind of in-network restricted little tiny MAPDs, but most of them do not have a premium. But that is not really a true explanation of the cost, because Medicare Advantage plans have things like copays, co-insurance, and out-of-pocket maximums, and these are all not created equal. It could mean that if you choose or change to an MAPD that offers the highest Medicare Part B reimbursement because you want to get that part paid for, but it has copays to go see the doctor that are much, much higher than you are paying right now, you could end up in a situation where now your plan doesn't fit your budget and you're stuck in it until the next year. Because it is important to understand that usually plans that have one benefit that is just maxed out, well, it means they have to pull that money from other benefits, and it could mean those are benefits that you actually need to use more than whatever that maxed out benefit is. The next one is another one that often gets lost in the mix of the copays and monthly costs and extra benefits, but arguably it is maybe one of the most important is your doctor on that plan? Now, this is a problem because a lot of the time folks see something like a free dog walking service or transportation or $0 copay to go see a doctor, and they make the decision to enroll into a Medicare Advantage plan only later to find that their doctors or specialists do not take that plan. They're not available. This is a huge monkey wrench in the gears of somebody's healthcare, especially if they have ongoing services, procedures, or pending operations. Often it can even be the case that the doctor and the specialist do actually accept that insurance, but they're not on the same networks within the same plan, meaning that the beneficiary is only able to see one, but not the other, or the other, but not the one. This is an unfortunate situation because the doctor's networks are relatively complicated and continually shifting, which means that they are easy to overlook, and the less complicated and more shiny benefits like free gym memberships get kind of maximized. Next up is more of a personal question for all beneficiaries, which is, it is important to understand that if your Medicare Advantage that you are looking at actually fits your needs. We all have those shirts in our closet that we bought hoping one day we would fit into, but never do. The same is for the Medicare Advantage plans, because they will have things like a free gym membership or extra benefits like fitness programs or over-the-counter benefits that can be very enticing. But if you don't use those benefits now, how likely is it going to be that you're really going to start using them once you get access to them? I mean, for example, a free gym membership has basically a 0% usage, but almost 100% likability from Medicare beneficiaries, even though it never gets used. These types of benefits could be great if you know you're going to go and use them, but if not, is it worth moving around your doctors, increase your cost potentially, or other parts of your plan that you were so settled in with just so you can have a gym membership that you could probably even have discounted with a senior discount on its own? That's a decision for you. Last up, and this one is very similar to the Doctors Network question, is that Medicare Advantage plans here in Southern California mostly will have prescription drug plans or Part D plans connected to the enrollment. Part D plans are complicated, they are confusing, and they are pretty convoluted, and it means that most folks just pay attention to the copays and don't think about it at all. But if somebody is changing their Medicare Advantage plan and there is a Part D change that also happens as a result, they can be in for a rude awakening when they go to get their standard monthly prescriptions and find out that they are way more expensive or not covered at all, or they're limited in quantity. All this can be as a result of a new plan having a different formulary or having different prescription drug policies. Moreover, again, even plans with the same company may have different formularies to match the beneficiary's needs for each specific plan, especially in the case of special needs plans that specialize in plans designed for folks with things like heart disease or diabetes or Medi-Medi. Those plans can have different formularies, and if somebody enrolls and is under treatment, you would want to check that your existing medications or ones that can be used in their place are available and at similar prices. Otherwise, folks end up having to change back, or worse yet, get stuck a whole year in a plan that doesn't cover the prescriptions that they need. All right, so there we have it. The 5 things you should be looking at first before you enroll into a Medicare Advantage plan. First is the Medicare Advantage plan available in your area? Second is, does it fit your budget? Third is, does it have your doctors? Fourth is, does it fit your healthcare needs? And fifth is, does it have your prescription? Because if any one of those things are off, it may take some real consideration of the trade-offs if changing from one MAP to another actually makes sense, even if you don't get those shiny extra benefits that are oh so tempting. All right, so that's it for today's Michael's Medicare, and I really hope that you enjoyed this video. And if you or somebody you know is trying to work through some of or any of the Medicare quandaries we talked about, please feel free to reach out to us at the information down below, or leave a comment, or just like and subscribe and you get notified when our newest content comes out on the socials, on Instagram and on YouTube, because we have new great Medicare content coming out every single week. So for Michael's Medicare, I'm Michael. Hoping you have a great rest of your day, and goodbye.